As Minister of Health, I am thrilled to offer remarks to signify the commencement of the Diabetes Association of St. Kitts Week of Activities to be held over the period 8 to 15th November 2020. This is a time of year when there is substantial focus on diabetes, a major public health issue in the Federation of St. Kitts and Nevis and beyond. And while I am inspired to offer these remarks, I am quite cognizant that the condition of diabetes is an extremely serious matter. The concern is universal, and statistics have revealed its escalating prevalence globally, with the most poignant and devastating increases seen in the developing countries such as ours. Diabetes is a chronic, progressive, non-communicable metabolic disease characterized by elevated levels of blood glucose sugar. It occurs either when the pancreas does not produce enough of the insulin hormone, which regulates blood sugar, or when the body cannot effectively use the insulin it produces. When diabetes is not detected early and not properly controlled, the health consequences are dire. Diabetes can damage the heart, blood vessels, kidneys, eyes, and nerves, resulting in lower limb amputations and other serious complications such as disability, job loss with reduced household income, as well as psychological problems. The World Health Organization and the International Diabetes Federation are recognized international entities that are working with countries to advance the fight against diabetes, particularly when there is a sobering realization that the number of persons living with diabetes worldwide has almost quadrupled since 1980 to approximately 4.5 million adults. Of great significance is that the global prevalence of diabetes among adults over 18 years of age has risen from 4.7% in 1980 to a staggering 9% currently. Further, almost half of all deaths, which are attributable to high blood glucose, occur before the age of 70 years. Moreover, the World Health Organization has identified diabetes to be the 7th leading cause of death worldwide. These data are indeed startling. Because of the increasing burden on healthcare sectors and the significant impact on individuals, families, and communities, these global organizations are scaling up measures to strengthen healthcare systems to mitigate against the incidence of diabetes. Efforts to prevent diabetes surround strategies to address poor nutrition, lack of physical exercise and obesity, smoking and alcohol abuse, as well as food and environmental security through a well-oiled health promotion mechanism. It is therefore appropriate and commendable that the local Diabetes Association is joining with the International Diabetes Federation to bring awareness to diabetes, utilizing the theme, "The Nurse and Diabetes." Nurses make the difference. The theme brings into focus the crucial role that nurses play in preventing and supporting persons with diabetes, recognizing that nurses currently account for over half of the global health workforce. The theme is also relevant because the World Health Organization has declared 2020 the International Year of the Nurse and Midwife, being cognizant that nurses and midwives are indispensable to the healthcare sector and are often the first and only point of care in many communities. It is against this backdrop, therefore, that the Federation continues to invest in nurses and is depending on them to lead the charge to increase clients' awareness regarding the far-reaching effects of diabetes on society and advance health-promoting campaigns to highlight and combat the disease. The Ministry of Health thus applauds the St. Kitts Diabetes Association for undertaking an essential mission to 1. Promote diabetic education in the Federation and empower persons with diabetes to appropriately self-manage their condition. 2. Develop and disseminate educational materials to improve knowledge base regarding control and management. 3. Facilitate free exchange of knowledge with respect to diabetes among physicians, nurses, and other health workers, and to foster strong partnerships with family members as supporting persons within the household to enhance and ensure clients' compliance. Additionally, the ministry is in strong support of the association's proclaimed diabetic gospel, utilizing the acronym TEEM, TEAM. Test regularly, exercise regularly, eat wisely, and comply with the recommendations for prescribed medication. Clearly, if the principle of TEAM is embraced by persons with diabetes, no doubt there would be a monumental decrease in the incidence and severity of complications. The ministry hereby issues a clarion call for citizens to buy into TEAM and to rally with the Diabetes Association. As the number of persons with diabetes continues to increase in the Federation, it is clear that the ministry cannot fight this disease on its own. Therefore, partnerships with entities such as the National Diabetic Association are critically important. Noteworthy to mention is the fact that the Ministry of Health is intensifying efforts to ensure the well-being of this vulnerable group of persons, particularly at this juncture when non-communicable diseases remain a potent threat to our country and authoritative health sources have warned of the increased risk of COVID-19 to persons with underlying chronic conditions such as diabetes. With good reason, therefore, the Ministry of Health now has a notable cadre of trained personnel who graduated from the Stanford University Diabetes Self-Management Program. Owing to our strong cooperation with the government of Taiwan, a new 4-year project, Capacity Building for the Prevention and Control of Chronic Metabolic Diseases in St. Christopher and Nevis, has commenced based on a World Health Organization chronic care model. And the Ministry of Health secured the vital service of a volunteer diabetes educator from Taiwan who is working closely with nurses and is engaging in outreach at community health centers to empower persons with diabetes to successfully manage their condition. The ministry intends to strengthen care capacity for chronic metabolic diseases at all its health facilities through its nurses and other healthcare professionals, and enhance persons with diabetes self-management capabilities. The prime purpose of this week, therefore, is to fundamentally promote an increased awareness of diabetes and to highlight persons living with diabetes to garner greater societal support and mitigate against negative consequences. Thus, the week of activity, which commences today, Sunday, is meant to emphasize the message to persons that we should all individually, collectively, and consistently consume healthy foods and adequate water, foster a lifestyle that includes regular physical exercise and weight management to minimize obesity, and commit to engaging in annual medical checkups. As such, the association's activities surround the variables of good health and wellness and include a church service at the Pro-Cathedral of St. George's Bastille at 8 a.m. on Sunday, 8th November, a roundtable panel discussion at ZIZ from 8:30 to 10 p.m. on Monday, 9th November, an annual diabetes screening day at Independence Square on Friday, November 13th from 8 a.m. to 12 noon, and on Saturday 14th, which is dubbed World Diabetes Day, there is a grand walk for diabetes from the War Memorial to the ECCB roundabout and back, commencing at 6 a.m. The week of activities will conclude on Sunday, 15th November, with the association's annual general meeting at the Anglican Parish Hall, Victoria Road at 3 p.m. the Ministry of Health is justifiably grateful and immensely appreciative of the invaluable role the Diabetes Association is playing relative to persons living with diabetes. Thus, I encourage all citizens and residents in the Federation to support and participate in the Association's week of activities and wear blue this week. On behalf of the Ministry of Health, I pay homage to the executive and members of the association, particularly President Nurse Christine Watley. Do know the Ministry of Health appreciates your meritorious service to this vulnerable group. It is therefore with great pleasure that I officially declare the St. Kitts Diabetes Association Week of Activities open. God bless.